So now we're going to talk about nutrition metabolic pattern related nursing diagnosis of impaired oral mucous membranes. So some of the significant causes or risk factors of impaired oral mucous membranes are listed here. Dehydration or decreased salivation. So really anything that will cause dryness or drying out of those oral mucous membranes can lead to um, ulcerations or impairment. Poor oral hygiene, of course, that can lead to the buildup of uh, microorganisms inside the mouth that can lead to impairment of oral mucous membranes. Malnutrition, just like that, can cause difficulties with the skin because of those rapidly turning over cells. The same thing happens, of course, within the mouth. Smoking can cause impaired oral mucous membranes. It causes vasoconstriction, poor blood flow to those mucous membranes. Chemotherapy, this is a really common cause of impaired oral mucous membranes, most commonly associated with things like thrush or these kind of opportunistic infections that pop up inside the mouth because of the significant weakening of the immune system. And so chemotherapy patients need to be closely monitored for any issues inside the mouth. Same thing with immune system diseases or immunosuppression, really kind of the same mechanism where you're getting opportunistic infection. Trauma, anything that causes, damage to those mucous membranes, um, or infection. So, again, any opportunistic infections, infections from poor oral hygiene, infections from sores inside the mouth. The inside of the mouth tends to be full of bacteria, that kind of thing. So infections really can become common and need to be watched because infections inside the mouth can cause infections other places as well. There are several pharmacological interventions we can take when people develop problems with their oral mucous membranes. Some of them address pain. Some of them directly address any infections, especially kind of some of those opportunistic ones that we talked about. So clotrimazole is used to treat thrush. This is usually administered as a lozenge inside the mouth. Um, Nystatin suspension used to treat fungal infections. So the patient will swish that solution kind of around in the mouth and then spit it out on a kind of scheduled basis, maybe BID, TID to treat a fungal infection. Chlorhexidine can be used. It's the trade name, I think, for this is something called Paradox. We use this very commonly in the hospital to reduce the amount of microorganisms. It's an antiseptic mouth rinse. We use it pretty frequently, especially for maybe patients who are on ventilators, just to reduce the amount of microorganisms inside the mouth that could lead to things like pneumonias. But in the case of oral mucous membrane impairment, it prevents any infections or buildup of microorganisms inside the mouth. And it doesn't have the same kind of drying effect as some of those commercial-based mouthwashes that contain a lot of alcohol, which should be avoided in these patients. Chlorhexidine is better tolerated. Viscous lidocaine, this kind of swish and spit solution, is often used to reduce pain inside the mouth. Patients who develop impaired oral mucous membranes are at risk of poor nutrition because their oral intake goes down related to pain. So we can use viscous lidocaine to kind of reduce that pain. You do need to be really cautious though when you are numbing the inside of someone's mouth. You need to monitor closely kind of what they're eating. You'd of course want them to if they have impaired oral mucous membranes, you want them to avoid things that are really hot, regardless, because they are painful. But especially if you have someone with numbing inside the mouth, you want them to avoid anything really hot coffees, teas, soups, because they could burn themselves. Any food that's like kind of sharp, you'd want them to avoid too, because they might not feel kind of that trauma to the inside of the mouth. Diphenhydramine liquid, this is often mixed with something called magic mouthwash, which is pretty commonly used in patients with impaired oral mucous membranes. This particular component is used to kind of reduce inflammation inside the mouth. And then the final thing is the aluminum hydroxides or mag hydroxides, some methicone suspensions. These three things are used to kind of coat the inside of the mouth. It's almost like a band-aid for the oral mucous membranes where they kind of cover it to protect it from any further damage while it heals. So some common signs and symptoms to be looking for if you're assessing the inside of someone's mouth who might have some of those risk factors that we talked about earlier for impaired oral mucous membranes. You would look around on the mouth, the tongue, or back in the pharynx for any lesions. Look for any kind of coating inside the mouth or cracking of those mucous membranes. Sometimes patients will report dysphagia or trouble swallowing with no other known cause. So if you look inside the mouth, you might see some of those other signs of impairment for those patients. And they may report throat pain or mouth pain as well. So some common nursing interventions that we can put into place for these patients. We're going to encourage oral care, probably more frequent oral care, maybe even every 2 hours if we don't have good control. But we're going to do that very cautiously. We're going to use soft toothbrushes, and we're going to avoid putting any chemicals inside the mouth that could further inflame. So again, things like those commercial mouthwashes that contain alcohol will further dry and inflame the inside of the mouth. Same thing with something called a lemon glycerin swab. These are commonly found in hospitals, and we use them for patients who maybe are NPO for some reason or are on medications that make their mouth dry. And as long as their oral mucous membranes are intact, we sometimes use those to kind of help them just not have that kind of dryness inside the mouth. But for a patient who's at risk for impaired oral mucous membranes or who has that impairment, we want to avoid those because again, they can cause drying and further exacerbation of that condition. The last thing here are toothpastes with sodium lauryl sulfate. Sodium lauryl sulfate is a common ingredient in toothpaste, and really a lot of kind of over-the-counter hygiene products. It's the chemical that causes kind of that foaming of soaps and toothpaste and that kind of thing. And it has been linked to an increased risk of sores inside the mouth. So things like canker sores have been linked to that particular ingredient. So if you have someone who might be at risk for or who has sores inside the mouth, you want them to look for toothpastes that do not contain that ingredient. You can also have your patients rinse their mouth more frequently, maybe with a warm saline solution, so 0.9 normal saline, or a sodium bicarbonate solution. Those most closely kind of mimic the like kind of fluid electrolyte balance of your normal body fluids. And so they tend to feel kind of the most soothing to those mucous membranes. And then topical medications as prescribed. So any of the things on that list of stuff we talked about, and they're often, what we use is often guided by maybe the cause of the impairment, whether it's fungal, whether it's, dryness, whatever it might be. So we choose topical medications that are most closely related to the etiology of the oral mucous membrane impairment. So another really important thing for nursing to think about with impaired oral mucous membranes is really supporting that patient's hydration and nutrition as well. As I mentioned earlier, some patients with impaired oral mucous membranes, because they have pain in the mouth, they might not eat as much. They might have trouble swallowing. So we really have to make sure we're focusing on nutrition and hydration as well. To provide the most comfort for patients while they're eating, you want to choose really soft, bland, and non-acidic foods. So you would avoid things like tomato sauces, citrus fruits, anything with high volume of acids. Foods that are cool or cold will be better tolerated than anything that's hot. You want to focus on getting a high amount of protein and foods with vitamin C because those things will help promote healing inside the mouth. But with vitamin C, again, making sure that you're not pushing things like citrus foods because that will cause acidity. And then anything hard, spicy, extra salty, acidic, all of that stuff is going to irritate those ulcers. And so you want to avoid those things as well. So really soft, bland, non-acidic, cool and cold is the best way to go.